Welcome, family. In today's knowledge, let's talk about ectopic pregnancy, causes, risks. Watch till the end as I talk about the signs and symptoms of ectopic pregnancy, how it is diagnosed, and many more you will learn. Please subscribe if you haven't, like and share. An ectopic pregnancy occurs when the fertilized egg attaches itself in a place other than inside the uterus. Most cases occur in the fallopian tube and are thus sometimes called tubal pregnancies. The fallopian tubes are not designed to hold a growing embryo. The fertilized egg in a tubal pregnancy cannot develop properly and must be treated. An ectopic pregnancy happens in 1 out of 50 pregnancies. Ectopic pregnancy symptoms. Although you may experience typical signs and symptoms of pregnancy, and a pregnancy test result may be positive, an ectopic pregnancy can't continue as normal. The following symptoms may be used to help recognize a potential ectopic pregnancy. Sharp or stabbing pain that may come and go and vary in intensity. The pain may be in the pelvis, abdomen, or even the shoulder and neck due to blood from a ruptured ectopic pregnancy pooling under the diaphragm. Vaginal bleeding. Heavier or lighter than your normal period. Gastrointestinal symptoms. Weakness, dizziness, or fainting. It is important to contact your doctor immediately if you are experiencing sharp pain that lasts more than a few minutes or if you have bleeding. What are the causes? An infection or inflammation of the fallopian tube can cause it to become partially or entirely blocked. Scar tissue from a previous infection or a surgical procedure on the tube may also impede the egg's movement. Previous surgery in the pelvic area or on the tubes can cause adhesions. Abnormal growths or a birth defect can result in an abnormality in the tube's shape. Who is at risk for having an ectopic pregnancy? Maternal age of 35 to 44 years. Previous ectopic pregnancy. Previous pelvic or abdominal surgery. Pelvic inflammatory disease, PID. Several induced abortions. Conceiving after having a tubal ligation or while an IUD is in place. Smoking. Endometriosis. Undergoing fertility treatments or are using fertility medications. How is it diagnosed? Ectopic pregnancies are diagnosed by your physician, who will probably first perform a pelvic exam to locate pain, tenderness, or a mass in the abdomen. Your physician will also use an ultrasound to determine whether the uterus contains a developing fetus. The measurement of HCG levels is also important. An HCG level that is lower than expected is one reason to suspect an ectopic pregnancy. Your doctor may also test your progesterone levels because low levels could be a sign of an ectopic pregnancy. In addition, your physician may do a culdocentesis, which is a procedure that involves inserting a needle into the very top of the vagina, behind the uterus and in front of the rectum. The presence of blood in this area may indicate bleeding from a ruptured fallopian tube. What are the treatments? Methotrexate may be given, which allows the body to absorb the pregnancy tissue and may save the fallopian tube, depending on how far the pregnancy has progressed. If the tube has become stretched or has ruptured and started bleeding, part or all of it may have to be removed. In this case, bleeding needs to be stopped promptly, and emergency surgery is necessary. Laparoscopic surgery under general anesthesia may be performed. This procedure involves a surgeon using a laparoscope to remove the ectopic pregnancy and repair or remove the affected fallopian tube. If the ectopic pregnancy cannot be removed by a laparoscopically, another surgical procedure called a laparotomy may be done. What about my future pregnancies? Your HCG level will need to be rechecked on a regular basis until it reaches 0 if you did not have your entire fallopian tube removed. An HCG level that remains high could indicate that the ectopic tissue was not entirely removed, which would require surgery or medical management with methotrexate. The chances of having a successful pregnancy after an ectopic pregnancy may be reduced, but this will depend on why the pregnancy was ectopic and your medical history. If the fallopian tubes have been left in place, you have approximately a 60% chance of having a successful pregnancy in the future. Rupture of an ectopic pregnancy can lead to symptoms such as abdominal distension, tenderness, peritonism, and hypovolemic shock. The most common complication is rupture with internal bleeding, which may lead to hypovolemic shock. Damage to the fallopian tubes can lead to difficulty becoming pregnant in the future. The woman's other fallopian tube may function sufficiently for pregnancy. After the removal of one damaged fallopian tube, pregnancy remains possible in the future. If both are removed, in vitro fertilization remains an option for women hoping to become pregnant. Want to know more? Subscribe, like and share. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.